So I decided to focus my quality improvement presentation on alcohol abuse. So a commonly seen issue is definitely alcohol abuse on my floor. I work on a med-surg psych floor, so we do have patients who come in or going through alcohol withdrawal, usually detox. So we will help them get through that detox by giving them PO Ativan or IV Ativan based on what they need. A lot of these patients, unfortunately, we do see as regulars. We will go through the whole process of detoxing them, and unfortunately, they usually come back with the same problem, so we'll have to go through the whole detox again with them. The saddest thing that we have seen is some of these people do come back, and based on the damage that drinking has inflicted on their bodies, we have to make them care and comforts, and they eventually do pass on our floor. Probably the saddest case I have seen was a 28-year-old who drank herself to death during COVID and came in with liver failure. She had passed within a week of being there. So, based on Healthy People 2030, there have been 20 million adolescents and adults in the United States of America that have dealt with substance abuse, including alcohol abuse, in the past year. Excessive drinking is viewed as binge drinking and heavy drinking. Binge drinking for women is having at least 4 beverages at one time. For men, at least 5 beverages consumed at a single event. Heavy drinking, at least 8 beverages each week for women and at least 15 beverages each week for men. Concerns also involve pregnant women who use alcohol and anyone under the age of 21 who consumes alcohol. So, effects of alcoholism. High amounts of alcohol consumption can lead to heart disease, strokes, higher risk of developing pneumonia or other respiratory problems, pancreatitis, cancer, liver failure, and death. Alcoholism is known to kill more than 140,000 people each year in the United States. Hospitalizations for these adverse effects of excessive drinking cause a large expense for healthcare. So with addressing the issue comes down to preventative care through primary care, and I intend on ensuring that excessive alcohol consumption is monitored when I am working as a family nurse practitioner. The best way to decrease the number of people affected by alcohol abuse is to educate patients early on and screen patients during yearly physicals. Screenings for alcohol abuse are not always followed through when patients go to their primary care. For example, in a survey of 7,371 adults reporting a visit to a medical practitioner, slightly over a third of adults aged 18 to 49 years were asked about alcohol and drug use, and those over age 49 were asked less often. The implementation of screenings and ensuring they are completed, as well as following up with the patient about resources they can use, should help decrease the number of cases of alcohol abuse we see in the United States. So for my aim statement, I put that my goal would be to identify patients through screening tools who are at risk of alcohol abuse, educate them on the risk of adverse effects of high alcohol consumption, and offer resources to patients who are struggling with alcohol abuse. So I plan to instill screenings on patients at yearly physicals that will assess consumption of alcohol through questionnaires. I hope this produces an increase in awareness of excessive alcohol consumption and decrease the number of patients who experience alcohol abuse. Steps to execute: I will work with adults and teenagers who are coming in for yearly physicals and work on screening them for increased alcohol consumption through a questionnaire when they arrive. Screening tools that are used in the health profession. We use Cage a lot. I know I have used it plenty of times in the hospital. It is a screening tool that uses 4 questions. These 4 questions are: have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? And have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover, which would be considered an eye-opener. Another screening tool that is commonly used is the audit. The audit screening asks 10 questions on a patient's alcohol consumption and totals up points to see how at risk they are of having or developing alcohol abuse. A lot of these questions are based on how often do you drink something containing alcohol, how many drinks containing alcohol do you have on a typical day when you were drinking, how often do you have 5 or more drinks on one occasion, how often during the year have you found that you were not able to stop drinking once you had started, how often during the last year have you failed to do what was normally expected of you because of drinking, how often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session? How often during the last year have you had a feeling of guilt or remorse after drinking? And how often during the last year have you been unable to remember what happened the night before because of your drinking? Have you or someone else been injured because of your drinking? Has a relative, friend, doctor, other health care worker been concerned about your drinking or suggest that you cut down? The good thing about audit is it also shows a display of what a drink is exactly. So you would have a 12-ounce beer displayed on there, 5 ounces of wine, which would be considered the pour that you would have instead of filling it all the way up to the top of the glass. And then also a 1.5-ounce shot of liquor, what you would expect in a martini. That way it's kind of displayed for the patient to understand exactly what amount we are talking about. So when implementing this plan to use screening tools, I will look to observe how many patients are completing these surveys, while also observing how many patients receive a high score, indicating some alcohol abuse or risk of alcohol abuse. I'm sure that I would observe some screening tools not being handed out or completed by patients. The study, so based on the study completed by Pulaski and Wu, the two tests, audit and CAGE, generally perform better than other methods used in assessing for alcohol abuse. Other tests look at asking about frequency and quantity of alcohol use or consumption. The audit and CAGE look into how people feel about their consumption of alcohol and if they feel like they rely on it or if others around them worry about how much or often they consume alcoholic beverages. So based on my observations, if I noticed that screenings were not being handed out to patients when they were being checked in at the front, I would meet with the team to discuss the importance of these screenings. I would also mention the screenings to patients when seeing them for their physical, in case they did not receive a screening while checking in or ended up not filling one out by mistake. In either way, it is important to assess alcohol consumption with patients and educate them on the amounts of consumption that are considered high risk for alcohol abuse. Once establishing that a patient is at risk, it is essential to offer resources and check in with the patient while they are utilizing these resources. Such resources could be therapy sessions, checking in for rehab, and AA meetings. So in summary, after working with a large group of patients who suffer with alcohol abuse and adverse reactions from excessive drinking, I plan on addressing this problem as a nurse practitioner. My plan is to ensure that all patients are assessed for excessive drinking, alcohol abuse, through screenings like CAGE and audit, and help these patients connect to resources in the community. I will also educate patients who are at high risk for developing alcohol abuse of the repercussions of consuming high amounts of alcohol frequently. I will make sure that these patients are followed closely to ensure they are receiving treatment and for their addiction through frequent checkups. It's important to implement these surveys to ensure that we are picking up on patients who are at risk of alcohol abuse and addressing it early on before it becomes a major problem in their health. And it is so essential to follow up with these patients as they are receiving treatment. here are my references. Thank you.